Welcome to VetMatch Chat. This is actually our very first, and we are so excited about this opportunity. And we've got some incredible panelists. We have so much that we have to cover. It's unbelievable what we have accomplished already and what we have yet to accomplish. So thank you so much for joining us. We encourage you to tag. We encourage you to invite others to join in this live streaming. We anticipate that it will be about an hour, although we are tagging on an additional 30 minutes just in case. But believe me, we are doing a full cut at 90 minutes. We will not go beyond that. Join us this time. We have a variety of participants ranging from doctors, from support staff, from practice managers. We have private hospitals, we have corporate hospitals. We also have pet owners and clients that have gone through the cycle with it as well, and the technicians and everyone in this. So this is not just something that for someone that's in the veterinary hospital. This is something for someone that's involved with animals and pet care, because there is a crisis going on. We see the crisis in the industries throughout the country, even throughout the world. And we are right now focused on how to fix it in the veterinary side of things. And we think it's going to make a big difference everywhere. So I'd like to thank all of our panelists. We'll have a quick introduction to them for the moment. And then also a big thank you for Hands on Deck and Brooklyn Consulting, as well as we're working under the auspice of IBP Consulting Services in VetMatch. The purpose is bringing veterinary teams together. So we're going to go ahead and get started at this point in time. We want to have the opportunity to introduce you to everyone that is on the panel here. I'd like for each of our panelists, when they go on, I'll do a quick introduction of them. Remember to unmute at that bottom left sign. And then at that point in time, I do like just a quick introduction of who you are and how you're connected with the veterinary world. So starting with Kathy.
Hi, thanks everyone for being here with us. My name is Kathy. I'm currently living here in Denver, in Colorado. I am the Director of Special Accounts in VetMatch, as well with my own company, Brooklyn Consulting. And we're just all here just to kind of figure out what we can do to make a change in the veterinary field with everyone's input. So I'm super excited about today and grateful to have everyone here. And then you just have to unmute yourself.
Thank you so much, Kathy. Appreciate that. Okay, we're going to go on and hear from Lori Morogli.
Hi, I'm Lori. I'm from Houston, Texas, and I've been in veterinary medicine for about 14 years. I started in shelter med and then found my way over into emergency and specialty, where I dabbled in ICU triage. And then when I found my one true love, surgery, and I have stuck with surgery ever since. So my day to day is in the OR.
And thank you for all of your service there as well. Super. Okay, we're going to jump over to the Taylors.
Yes, hello everyone. We're super excited to be here with this great group of people. So we are Zakia and Tavares Taylor, and we come from the sales industry, and we are the proud humans of a Bichon mix named Snickers. Yep, you're on mute.
And all the way from North Carolina. So thank you very much. And then we're going to hop over to Dr. Coshell, also on the Central Time Zone, I believe.
Eastern. Hi.
Still Eastern.
I'm Dr. Amy Coshell, and I've been in the veterinary business I've been a veterinarian for 20 years in the Grand Rapids, Michigan area. I've done mostly relief work during that time, going from clinic to clinic and filling in. I'd been an associate for a couple of years here and there, and I taught a vet tech program where I was the medical director for about 3 years full-time there. So thank you for inviting me.
Absolutely. Some great conversations I've had with you about very innovative ideas too. So I'm very excited to hear from you. Okay, moving on to Sunny Weber from Colorado.
Hi, I'm Sunny Weber. I'm in Greenwood Village, Colorado. I have been in the animal advocacy world for 31 years actually. I'm a behaviorist, a trainer. I specialize in rehabilitating fearful dogs. I've got 5 books out on dogs, including a children's series on humane education. I've been very involved with veterinary medicine, obviously, because I've fostered for our largest shelter out here, the Dumb Friends League. I'm also very involved in Colorado Voters for Animals, where we legislate animal welfare bills at the state level. I am the new president of Colorado Animal Protectors, which is an educational outreach that we hope to reach out to all different animal rescue shelters and sanctuaries and combine our strengths. I have a special interest in veterinary medicine because I've been through so much with all the fosters and my own animals through all the years. And I've seen a lot of trends come and go and a lot of talented people come and go. And I hope to help you keep talented people working.
Quite an accomplishment with everything you're doing there, Sunny. Thank you so much for your support of the animals and everything you're advocating as a whole. So honored to have you, that's for sure. All right, let's jump on to Liz Denleck.
Hi, my name's Liz. I've been a certified vet tech for 16 years. About 5 years ago, I got my certification in hospice and palliative care for animals, which then led me to social work. So I got my bachelor's degree in social work last year, and I am planning on graduating next year with my graduate degree in social work. And I have a passion for end of life in both humans and animals and how I can impact the veterinary culture and improve it for everybody.
Your insights just on social work are going to be incredible because of the value of what we're talking about for the veterinary community and the support teams and how people are being impacted as a whole by the stressors. So I definitely appreciate your insights here. And last but definitely not least, we do have Dr. Ann Pasic, private veterinarian from Colorado as well.
Hi, I am a Colorado State University grad. I've lived in Colorado my whole life. I come to veterinary medicine in a weird way. My dad was a vet. We literally lived in the building. So my experience is about 40 years. 20 of it is an official veterinarian. So I've seen a lot of trend changes, and this has been a very interesting last few years. So with that, I am happy to be here as a vet. I'm also got the holistic world kind of covered with a little bit of acupuncture, and it'll be interesting to see what all of you think.
Yes. And with your insights, also having grown up in veterinary medicine, you've probably seen quite a few changes that I'd love to see how to hear out of that. And I apologize, my screen had cut, and definitely not last but least, but Daisy Chavez, I apologize. So definitely let's give you the floor for the moment. I'm really excited to have you because you come with a different perspective as well from a management as well as corporate side. So Daisy, mic is yours.
Yes, good evening, everyone. My name is Daisy Chavez. I've been in the veterinary industry for about 15 years now. I started off as a certified technician, worked my way up to practice manager for about 4 years in the corporate world. And currently I'm in Denver, Colorado, and I'm the hospital director for a 24/7 emergency hospital that also has a satellite location about 10 minutes away from the hospital. And yes, I do come from corporate business, basically.
Sure. Cool. All right. Well, this was an opportunity to get to know our panelists. And the questions that we have here are some that will direct to some of the panelists because of some of the circumstances and because of the interpretation that they'll have. So we may, because we won't have so much to talk about, we're not going to be able to have all of our panelists answer all of the questions. And I'll be directing to direct, but if you do feel that you have something important to add, I don't want to exclude you. So as a panelist, please go ahead and just kind of raise your hand and we'll be sure to get you in. Also, if you're listening right now on our live Facebook feedback, or you have a question in the future as they're watching this recording, I encourage you, use the comments below to write a question or make any kind of comments or your perception, your experiences, so that we can incorporate and learn from it as well. So are you all ready? Thumbs up. Here we go. What I wanted to do as we go through this is just do a very brief description of what does it look like right now? Then we'll look a little bit in the past and then heading more towards into the future. So the first question I'm actually going to ask of Dr. Pasic. Dr. Pasic, what do you feel are some of the main changes that you've seen, even as your insights from growing up in the veterinary world to within even the past year, some of the main significant changes that you have witnessed and experienced? And so that, I know it's a long question, but if you could give us a couple minute response on that.
I think the biggest thing is the way that veterinary medicine has evolved. My experience is going to be in the 80s, the 90s, and beyond now. So I think, we used to do a C-section for $200 and stay up all night. And it wasn't even, nobody even thought about that as too little or too much. Veterinarians were afraid to charge more. This was before emergency hospitals were around. Veterinarians just kind of had to do it all. And so there became, after I graduated, kind of this word standard of care. And that then became the new threshold of how to practice. With that change, I think then we started to have diagnostic equipment in the hospital. Certain surgical abilities were not available at your hospital that might have gone to a referral place. And then the change of perception of the veterinary medicine world kind of started to move with that. However, a lot of clients were still stuck with, oh, well, you can do it all. I don't want to go anywhere. And so there's been a shift of, there are really good specialty people out there, but not all clients are going to go there. And so the regular veterinarian is stuck with, still the clients are expecting a $200 bill, but they want you to do standard of care. So there's the support staff that goes around that, the equipment that it takes to run it, and trying to put value in what you're doing because you can't afford $200 for something.
Right, right. And what do you think has changed over just the past year or two? Actually, we're about 2 years out now. So what are some of the changes you've seen there?
The biggest change I see is probably the staffing and the clients. I feel very lucky in that I have got a clientele that is very good. They let me do a lot. I have a lot of communication and we get away with a lot, but I know there's lots of veterinarians out there who have not had a good experience. They're either not be as communicative with the clients or they don't reach them right. And there's a lot of anger. And that hostility is really, I think, COVID driven. It's like everybody's, I want to say their thresholds are lower. Their anger management is not in check. Their filters are not there. And so that's hard. The other thing that's happened is I get that the veterinary world is not really equipped to spend 30 to 40 bucks an hour on each staff member. But that's the going rate for survival in this economy anymore. And so now we're trying to find help that's good, but we can't afford that kind of help. And I've got younger people who are trying to be employed that are legends in their own mind, who really think they know it all. But you get them working on the floor and they really don't know what they're doing, but they act like they do. So there's this delusional component sometimes to it too. So being around long enough, I feel like I know what they're supposed to be doing, but it's hard to make that communication gap politely.
Right, right. I'm going to take this to an owner's perspective. So Zakia and Tavares, if you could give an insight on what changes have you seen in your puppy, Snickers? It's not a puppy anymore. What are some of the changes that you have noted, if any, over the past few years and perhaps even over the pandemic?
Oh yeah, absolutely. So our experience as change would be over a 10-year threshold. So Snickers is 10 years old. And I remember when first, receiving Snickers, the vet that I took him to, and I'm still with that vet, it was more or less a private practice, very small, but it has evolved over the past couple of years into like this, what was like almost a franchise, a type of deal. So I see pros and cons of that, evolution where, they offer plans in place. So, to make sure that Snickers is there for his wellness visits. Of course, now our places of employment have pet insurance. So, it's the perks of being able to have some cost efficient ways in order to make sure that Snickers get the care. But also from a con standpoint, from the evolution that I've seen in the past 10 years, it's been sort of some churning within the veterinary clinic. And I'm very protective of my baby, of course. So, he's had 3 different vets right now. And, I'm very curious as far as what their background, are they going to treat him well when they take him to the back room? But some of the techs have still been there, and and that's very comforting to know that he has familiarity, me and him, as he gets his visits, because he's not very happy when he goes there. So just knowing that when we go there, we know, have people there that know his quirks and, and can care for him. But so those are the pros and cons that I've seen, within the past 10 years of Snickers, is just, the affordability of healthcare, but at the same time, I have seen this churn. And from a COVID standpoint, oh my gosh, it's like I couldn't go in the building. You had to pass your baby over through the car. And I know we've all had to make those changes, but from a pet owner, it's almost like turning your child over through a car window, and you're not there to kind of comfort them, and knowing that, if he's not at his best when he goes to the vet. So we've overcome that obstacle. So now we're able to go in. But from a COVID aspect, I was just still happy that the doors were still open for his wellness visits.
That makes sense. So yeah, so the stages in life, you're definitely seeing changes within how that would be handled, and the stages of life of your practice, how that is handled and different together with the pandemic. So you've seen multiple factors. Thank you for sharing that. Daisy, with you being in a management hospital director role, I'm sure you've seen some of these challenges that both Dr. Pasic and that Zakia have mentioned with respect to finances and such. What is your take right now with the vulnerability with our staff, where they are needing to have higher compensation in order to survive, yet balancing that in a business perspective to make sure that you can pay the bills, and at the same time, how much of that can you pass over to your clientele and expect them to bear the burden of that cost? So can you comment on that?
Yeah, I think we're starting to see a little bit more of that gap widening as we're having to pay our technicians a lot more to keep them on board. Our client compliance, like we were mentioning earlier, has decreased because we can't charge the client appropriately when we're having to pay our staff and pay for the equipment. And so there's that gap of just maybe not understanding from the clients and understanding everything that goes on with the hospitals. And so it's really difficult to balance. The need for veterinarians or hospitals right now is so great. We just have been inundated with a lot of clients wanting to come in because of COVID, that there is this imbalance, and it's extremely difficult to manage when you want to have your good teams on board and still be there for the patients and the clients. So it's been difficult. I feel that with employers offering things like pet insurance as a perk, for their associates, is definitely going to be needed in the future to compensate for some of those changes that we're having to mitigate with the veterinary industry across the line. Everything has kind of gone up in prices, and it's just kind of communicating that to the client so that we don't have that hostility and that maybe not compliance as we used to before. So it's been a challenge for sure.
And I don't envy you on that one bit. I know that as we're working and in connecting the mass exodus, so to speak, which we will get into that in a moment, together with how do we bring them back? We call it the magnetic effect or the boomerang effect, actually. The boomerang being that whoosh, we losing many, and then our point is to bring them back in, and that it has to do with some of those cultural things. So I'd like to tap in with Lori at the moment here. Lori, with your experience, especially in how things are handled, we were just speaking about it earlier about the expectations of the staff members, and perhaps management doesn't quite get it, or the team you're working with, of how much you actually do have to do. What are your thoughts of the pressures that are or the stresses or the expectations of someone in your role as technician?
I think the biggest thing that maybe people don't put together is, so in human medicine, right, you have your phlebotomists, you have your lab techs, you have your rad techs, you have your surgical techs. And as a veterinary technician, depending on where you work, GP, emergency, you are all of those things. You know, when I worked in triage, I was running diagnostics. I was taking my own x-rays. If my patient was admitted, I had to get him started on treatment. I had to write up an ICU medical log, and then ICU would take that over. So there is a lot that we do that I just don't think people realize as a whole is a lot for one person. And with those responsibilities, you get more. The more that you know, the more that you're capable of doing, and they start tacking it on, and they don't always compensate for that. And so that can be overwhelming at times, especially when you do get rushes of patients that come in. And as I said, it can be really hard, especially when you're very short staffed and you have to be 6 people at one time,
Yeah. And then going on now to Liz, you have done a lot of these studies in social work as a whole. Can you share with us the impact you feel that this has on the staff?
Yeah, I mean, I've definitely seen the staff shortages as well and felt them myself. But also I've seen burnouts, a lot of burnouts, which is not good. It's creating more staff shortages. It's creating, it's like if you look at it from a systems theory approach, burnout is caused by, excessive stress at work. It can be caused, that could be a number of things. Maybe you don't get lunches, as many of us don't get in the veterinary profession. So I've seen a lot of burnout, which impacts people, and hospitals aren't accounting for that. Maybe they don't know how, maybe they can't because of the staff shortages. So I would say that's a big thing I've seen.
Okay. And do you feel that the pain and the difficulty being met or swallowed or just, accepted by the veterinary staff, doctors, technicians, do you feel that stress is only from the workplace, or do you feel there are outside factors as well?
I mean, certainly I think that outside factors only compound the stress that we have. I think that as veterinary professionals, we often are perfectionists and have a unrealistic sense of selves. And so we put a lot of pressure on ourselves. So I think that with the stresses of the job only exacerbate the burnout and compassion fatigue.
Okay.
If you don't mind, I'd like to add on if you
Please, Lori.
don't mind. So I think burnout comes from an assortment of different perspectives. So burnout could mean a large amount of things needing to be done at the same time. But I think from a psychological welfare standpoint, that burnout could be from just merely lack of appreciation or support. And so I think physically, yes, you have a lot to do, but at the same time, mentally, it definitely contributes to the burnout as well. So it's definitely both. And it comes from management, clients, teammates. So it definitely, hits you at all angles. And I think that's why burnout is so prevalent.
Thank you for adding that in. So Sunny, you have perhaps a little bit more insight into the veterinary world or such, but as a pet owner, were you aware of some of the stressors that were actually happening behind the scenes in a veterinary hospital? And you'll need to.
I was and I wasn't. I was fortunate enough, or unfortunate. During COVID, I had 2 major surgeries myself, and I had an old dog who was dying, and he was too big, and I was unable to get him into a car. So I was lucky enough to stumble across a nearby vet who did house calls, and he would come to the house. And so I got wonderful care. I got an excellent doctor. And together we saw him go to the Rainbow Bridge at the end of COVID. Well, it's not really ended, but before the office is actually reopened. But he has had a very steady staff, which has been a big comfort to me. So from my standpoint, I did not really see a lot of the issues that you're talking about, although I have been purposely avoiding some of the bigger hospitals because there's such a tendency to be impersonal at those places. But, a sick pet is every bit as worrisome as a sick child, and a nonverbal dependent who's ill and can't explain what's wrong is heart-wrenching for all of us, and it's frustrating and worrisome. So I look for a vet and a veterinary staff that I can establish a real connection with and of trust, because the emotional tie I have to my pet needs that scientific skill that's needed to problem solve and make my pet better. My burden of guilt when I feel I can see my pet is sick weighs on me, but how do I help them? And so I look for a staff that has answers and education and support. So at the time that I actually get to the office, I tend, and I'm sure all of us do in the public world, put a lot of pressure on the vet staff, because what we want from them are answers. We want support. We want emotional support, but we also want to know that you are the very best out there that we could possibly get for our pet. And that compassion burnout, since I've worked so much with shelters and rescues and sanctuaries, I see it, I understand it. And I think that in my position as a writer, a blogger, and working as I do in humane education, I'd really like to get in on this side of it and try educating the public as to what you all go through, and to get that out to the public so they're not like me, not understanding. They see what they see. They see their staff, they see their doctors. Now, if you need a specialist and you have to go to an emergency hospital or something else, it's very difficult. Like the Taylors said, turn your baby over to a stranger in a strange place. And since I specialize in working with fearful animals, that's a big problem, because all the work I put into the rehabilitating fearful dogs can be backslid when they have a traumatic event, and that could be at the vet. And
I want to jump in on that in just a moment, Sunny. So hold that thought with the animal perspective. And I think that's especially why I wanted you on this panel.
Okay.
I'm going to jump very quickly to Zakia and Tavares again. So were you aware of some of these stressors that are going on behind the scenes before today?
I think one of the things that we fail to realize is that we put that stress on people. I know that every time that we have to take Snickers to the vet, there's a level of anxiety that exists right there. And that anxiety is somewhat pushed over to the vet that we're bringing them to. So, it's human nature for that to just exist and transfer. So that transfer of emotions may show up in a lot of different ways. So I do think that we're aware of it, but sometimes people really don't have the compassion to understand that they're transferring those emotions over there.
Yeah, our vet handles it so well. I know, like when I take him even to get his teeth cleaned and they have to put him to sleep. I mean, I'm an emotional wreck. I cry every time time. And I know, to Tavares's point, that's probably transferred to the vet, but I was not aware to that magnitude that, and I know they have other pets, but when it comes to just Snickers, I only see myself and Snickers, right? That's my bubble. So this is very eye-opening to kind of understand, that the vet and the vet techs are human as well. So I know the next visit I'll be cognizant of that, but my baby is my baby.
And I agree with you. And when I'm working with hospital teams, it's one of those things that we always have to remind ourselves that, yeah, we may be doing how many nail trims or vaccines or dentals or other procedures, x-rays or blood works. We're doing that over and over, yet it's your first time. It's your one time, and be
Right.
very cognizant. So thank you for sharing that. So, Sunny, I want to get back with you, as you were mentioning with respect to the pets. How do you feel that some of these changes are impacting patient care that we've seen over the last, you've been working with animals for many years, as you've shared. What are some of the main things and changes that you have seen, or even something that has remained the same over the past few years?
I've seen a huge increase in behavior knowledge in veterinarians and vet techs, at least with the people that I've come in contact with. It may be because they know my behavior background, but how you approach an animal in a high stress environment like a vet office is extraordinarily important. I've seen so many vets over the years come straight forward, so many techs reach out, hand over the head, smiling, baring teeth, and dogs totally interpret that differently. Cats are another story because they're usually in a carrier and then they get grabbed and pulled out. So the behavior knowledge of how to softly approach an animal in the proper way, to start off from the very beginning on the right foot, that you don't just aggressively come towards any animal and take them out of their safe place, be it a carrier or their owner's side.
So you're seeing that the hospitals and the staff are more cognizant of that
Yes.
factor? Good.
Yes, in many, many, many cases, that's true. I think that's been a huge improvement. I have actually had to step in a couple times in the past and say, don't come up to my dog that way. This dog is fearful. And so, I do my best to educate when I find someone who doesn't really get it. But I think that the schools are teaching it better, but I'm not sure. Maybe they're just picking it up somewhere along the line, because if they don't, I tell them. But I do think that's been a huge improvement.
Good. So actually, I'm going to round to Kathy at the moment. Kathy, and especially what you are doing and in training and working with staff members and with hospitals and individuals. One of the main things you have emphasized since I've met you is the self-care component and the stressors that are happening in the staff. What I want to get towards now is, what are some of the solutions that we can maintain that are viable within a team? So first, my part one question to you, Kathy, is what are some of the impacts you've seen working within the field that has perhaps with some of the colleagues you have had in the past, or that you are imagining perhaps in the future? What is the impact to their career?
Yeah, I would say that, the most important thing is like the support and like the connection between like the staff members and colleagues. What I've noticed is that there is different levels of education and experience, and finding everyone where they're at and allowing them to learn in a training process without judgment, and allowing mistakes to happen without a harsh coming down on that. So it's just been really, for me, because I kind of am more of an empathic understanding, I've really taken such a big jump in always trying to understand, talk about it, see what we can do. If a patient has passed, I think it's extremely important to do postmortems and discuss what can we do better instead of pointing fingers. As another thing, I think it is important to have breaks and time and understand that this is an emotional career. And everyone wants to feel important and valued. So they want to feel like their input matters. I've had times where, sometimes vet techs have suggestions because we're the ones a little bit running the day. And the input is just kind of subsided and not really taken seriously, I would say. So I think it's just kind of a multitude. I think our voices are important and should be heard. I think doctors as well. I think clients, of course, as well. And it's just a community and how we can support each other. And I'm going to be honest, it is hard to have a lunch break. You eat on the go and you're ordering food, and it's just such a difficult thing because you aren't taking care of your health. You're coming in early, staying late, you're lifting heavy dogs. Sometimes they're not standing still. So a lot of people have back issues within 5 years or so in the field. And, there's just so many kind of different problems that are presenting. And I'm just excited for this panel to start discussing what are some options we can do as a community and start pulling in the right resources and start kind of changing things for the better. And honestly, pay is a factor. Once you've been in the field for about 10 to 15 years, the same price that is being paid for similar technicians that are graduating, there's a vast difference of knowledge at this moment. From the new technicians coming now to ones who have kind of been here for a while and kind of experienced it all. It's a very different dynamic, and we're not having that many technicians coming in. And a lot of that older knowledge is also leaving because of the burnout rate and compassion fatigue and, emotional wellness. So it's a big dilemma, and I'm just so glad we're doing this.
Yeah. So looking at kind of, not that we're going to have a solution here today and it'll solve all of the problems, I'd like to round back to Dr. Pasic and to Daisy for a moment. As we look at, there are very different dynamics. Dr. Pasic, as a private hospital owner, you have the ability to make changes however you want to, but you also have a smaller set of resources versus a corporate, like what we have Daisy, where she has a little bit more opportunity. Yet on the other side, Daisy may not have, she may have some of those financial resources, but on the other hand, there's not as much flexibility. So the first question that I'd like to ask is for both of you, and we'll start with Dr. Pasic, but how do you see this dilemma that Kathy was just speaking of, about having someone that has a high level of experience where their pay rate has not adjusted as much accordingly, in contrast to somebody that's coming in and doing the same job, right? So there's this dichotomy of experience versus performance of the same job. And this is something that I'm seeing is a big conflict, not just in veterinary medicine, but across the board in other industries as well. And how do we fairly establish this without breaking the bank? So again, I know there are no solutions at the moment, but what is your insight on that, and Dr. Pasic, and what changes are you considering, or what evolution are you going through regarding this topic?
That's a tough one. Okay, so I guess since COVID, the number of applicants that I am getting for a position is 0 to ghosting to none. So there is a problem where you just literally don't have the help, that you don't have the pool of people to even start to make a decision as to who's a great tiered tech versus who's a new tech. So that's been the first problem of the problems. I remember 10 plus years ago, I put in an ad for a technician. I had over 400 applicants. I had a spreadsheet. It was amazing. So this is a big change. How do I deal with it? So when I get more than one applicant for a position, I have the 90-day probationary period. I try to give them as much time to see what they're really good at. And I kind of say that how I structure your salary is going to be a bit based on how you perform. I start them at a base rate. I hope it's good enough for them to get into the door and want the job. And then I am just that person who can quietly change their their salary per hour fee based on how well they do. And if they're exceeding my expectations, I give them a raise. But the problem is I'm not getting people in the door to have a pool of applicants to choose from.
Yeah, no, we'll be able to help you with that shortly. But
Thank you.
But how do you feel? And again, this is a safe zone. So, but how do you feel that the dynamic between the corporate franchises or the corporate supported hospitals, where they're able to offer high signing on bonuses, $3,000, $5,000, $10,000? How does that impact you?
Yeah, I can't compete with that. So I think a lot of technicians, especially maybe all of the field of staff members in the veterinary world are leaning that way. If they get medical insurance, if they get a gym membership, if they get stipends for CE, I mean, I can match some of that, but I can't match it all. And so I end up with a pool of applicants who are burned out on corporate. And that's how I find my people. So it's not necessarily that I can compete, because I can't, but I just find that little pool of people who are just burned out on corporate.
Okay. Thank you. And I know it's very vulnerable to share that. And so thank you for that honesty. So now as we shift over to Daisy, again, you do have the corporate support. And so I'm not saying that finding staff members is any easier. And yes, we're helping you too. But what are your insights and what are your thoughts there?
I think that having corporate support is nice. It's nice because we're able to offer a little bit higher salary. However, I feel that there is an imbalance. It's tough for privately owned hospitals currently. I've seen a shift since COVID. I mean, corporate companies coming over and offering, just offering things to privately owned hospitals that they can't say no to. And it's really created, like, she just mentioned, a low pool of applicants who are willing to take less salary. And what I'm seeing is that in order for me to keep the people that I'm paying, a high salary, I also have to make sure that it's a good culture, because it's almost like all the corporate companies are just matching and going up higher and higher, which is making that imbalance greater for the privately owned hospitals, and also putting pressure on us to not only retain the technicians that we're able to recruit, but also keep them in with us, not have that corporate burnout like you were mentioning earlier. And so I think it's going to take a lot of us just really working together and figuring out what it is that our technicians need and want from a workplace, and trying to find a partnership in a middle ground so that we are supporting all of our hospitals. And so, yes, it's nice to have that corporate support, but at the same time, it's not the win-all for all the technicians. I mean, technicians still want to have that familiar place and family feel in a hospital, and feel supported as well.
Okay. And Dr. Coshell, sorry, I've not been intending to ignore you, but I know that you had a thought of something that would be in between. Would you be willing to share some of that now, or at least if you go to the full details of it? But what are some of the dynamics that you feel that some of the private practices are hurting themselves, or they're missing out on some opportunities that might help them with some of these dynamics?
Yeah. I've been doing relief for many years, as I said, and so it affords me an opportunity to go into these different practices and see what people are doing right and what people are doing wrong. It's always an opportunity to learn and see what's going on. And I get to see a variety of situations. I've been employed by corporate. I've been employed by private practices, 1 owner, 2 owners, 3 owners. And I see a little bit of the differences here. And when I think about it, I think about a lot of the differences between human medicine and veterinary medicine, and how we're offering a lot of the same services, right? We can do anything to an animal we can to a person. We can do all of the treatments. We can certainly offer that. And like it was mentioned before, we've seen this growth in this idea of a gold standard where increasing what we can do. But when we increase what we can do and bring this new technology and things, we do have to charge for it. And when people are holding us accountable for both, oh, we want the best, but we're not sure we can pay for it either. And so we're kind of in this between, kind of like, okay, well, and people ask me, what would you do for your pet? Well, I do it all because I have the means, I have discounts, and I can do it myself, things like that. So I can't offer, no one clinic, no one hospital can be everything to every socioeconomic level out there. We want everyone to have a pet. We want to be able to, but if we're going to say every single hospital has to have this huge standard of care, we're not going to be able to offer cheaper services for people who cannot afford it. So we have to kind of realize that no one hospital is going to be everything to everyone. And I do think that we have to accept that clinic C down the street that we may not agree with, are they really doing something that we would call malpractice, or are they doing something that is serving a socioeconomic group that we don't want to serve? That's fine. And we can say, yes, there's room for all of us. Honestly, we all know that, right? The doors are being busted down, our phones don't stop ringing. There's enough work for everyone. So that's one thing, is realizing that not every single clinic has to be the end all be all, and we do have room for that. Saying that, myself, I like to practice a little bit higher quality of medicine. I like to be in a place that has the bells and whistles, and I like to be able to offer ultrasound and all of the everything I can. I want it all available to me. But to do that, when I look at the different clinics I've been in, and I look around and I say, okay, if I went to my doctor, what x-ray machine would I be using? I'd go to a hospital, right? And when you have a centralized place like that, you can all use the same machine. If you look around and you realize how many veterinarian hospitals are within a 10-mile radius of your home, you have to realize that every single one of those has an x-ray machine. Every single one of those has a blood machine. Every single one of those has all of the staff, all the support staff, if you look at physicians, they don't have that in their office, and they get paid a lot more. We have magnitude of overhead.
And to put in some numbers, just so those of you that are listening, to put some numbers to these, X-ray will be what, a couple $100,000 plus tens of thousands maintenance every single year. Blood machines will also run tens of thousands of dollars. Ultrasound, there's another $50,000 to $100,000 just for this equipment.
Right. So when you have to replicate those services every 10 miles, that's a huge overhead that veterinarians are spending and wasting money on. Why? Because they want to do things their way. Each individual owner says, I'm going to go in and I want to practice my way. I want to make the decisions for everything. They get into that. We don't have training in business. In vet school, I was taught veterinary medicine. I do not have a business degree. And we have to figure it out ourselves. We reinvent the wheel. I go into these places and I feel like they're very isolated. They don't know what clinic A, B, or C down the street does. And they feel like they're in competition with each other. I hope that is fading. I really feel that that is something that is kind of going by the wayside. I feel that's something that the new generations do a little bit better, is networking and collegiality. I'm hoping that we're getting there. And I think that one of our solutions, of course not the only solution, but one of our solutions is going to be for veterinarians, individual veterinarians, to band together and create corporations just like lawyers and doctors do. We have the means, we have the know-how to do this. And to have 5 to 7 doctors go in and form a corporation themselves, if we don't want to be taken over by corporations, we're going to have to be the corporation. We're going to have to stop saying, I don't want the responsibility, and start saying, how can I share that responsibility with someone else? we have to stop saying, I want to do it my way, and start saying, well, I'm going to band together with other people and cooperate and maybe give up some control so that I don't have those stressors on my life. Because being a single practice owner, from what I've seen from a lot of people, is a lot of stress as far as, and I look at them and go, gee, I'm not smarter than that person. I couldn't do it any better. You know, I'm not arrogant enough to think that I go into these different clinics and see them struggling, and I'm not saying that I could do it better. I need help. I would need support to do half of what you do as a single practice owner.
I just actually have heard 3 specific points that you've made. Number one, not every hospital is everything. And I think I heard that also from Dr. Pasic, where we were referring to the specialty and such, and helping the clientele understand that. So there's an educational component that even Sunny had mentioned about helping educate. And so for Zakia and Tavares, for you to also suddenly have some more information to go by, this is a huge piece of that sharing mode. The second thing that I'm hearing as a consolidation from everyone's topics is that, yeah, we've got a lot of the financial aspects. We have an opportunity to decrease costs in some ways, which the corporations themselves have obviously managed to do very well. And that's why they are successful, not just with the financial, but also by allowing a sharing of other resources support, such as human resources or purchasing buying power, but also for training, et cetera, et cetera. And then the last thing, and I think this is where it really comes into play, is bringing people together as a network and letting the hospitals have a better understanding of how to collaborate, to be that collegial and bring that competitiveness out, which I think that's actually, when we go down to humankind, that we see that anywhere. Look at what is one way to decrease any crisis mode when there's a faction or 2 factions. Create a crisis, and suddenly the 2 factions are working together to overcome that. And this is where we have an opportunity for veterinary hospitals throughout the community close by physically, into through the state, through the region, through the state, through the world, for these communities to develop more as a support towards each other. Lori, I know it was a little while ago. I think I may have seen your hand go up, or was that, are we still there? Yeah, go ahead.
I just wanted to add like a small comment to that. And it might be a sensitive comment, but I feel like it's important anyway. I feel like the solutions are important, but I feel like background is really important as well, especially for owners. And I feel like there is a lot of financial competition, because I've experienced on numerous occasions where we almost get that client pressure that we are all about the business and that we don't actually care for the animals. And I feel like that's where the pressure comes from, to have these lower prices, like for more. I remember, I will never forget this. I had to present an estimate to a client, and they said, take my, this is all my grocery money, all my rent money. But you know what? Take it, because that's all you care about. All you care about is the money. And emotionally, that is so hurtful to a veterinarian, the technicians. And I feel like we feel very pressured to, as I said, have all of these services for a specific type of money. And that does put you in competition with privately owned, companies versus corporate and whatnot. So I really feel like it's important to know where the background comes from, because we do love the animals and we don't want to charge all these things, but we are putting the owners in a spot, especially in an emergency setting, where they have to make a decision based on financial needs. And emotionally, that is very triggering for clients, which is very understandable. But then they project that back onto our team, and that's where we see a lot of compassion fatigue and burnout and unappreciation, all because of money. And it's just all emotional triggers. So
thank you for sharing that. So we have a comment here from Snickers families, Zakia and Tavares. You're on.
Yeah, it feels like just like in the medical industry, when hospitals are taken over by business people, it feels like the level of care goes down. So there's a pressure put on the doctors to say, see this many people an hour, because this many people an hour is going to equate to this dollar amount. And so I always caution people to think about that when they say, yeah, we're going to get these we're going to get these resources, but the level of care, when you speak to the doctors, they will tell you that now my level of care for each patient goes down. My care for this, for Snickers is going to go down. I used to be able to do a full evaluation on Snickers and then give you guys a full like report card on them. Now it's like I have to get Snickers in and out in 45 minutes because I need 15 minutes in between my next visit, and then I need to see 7 more people or something like that. So it feels like if that's the case, and people are banding together become more collegial, I think that's the word you guys used. There's a trade-off with there could potentially be a trade-off in that regard.
Can you define that a little bit more when you're saying trade-off? I just want to make sure that we're clear on that.
The trade-off to me feels like the level of care could potentially go down because there would be a pressure to see more to make up for me. So let's make up for the amount of resources that are poured into you.
Yeah.
So in other words, you're saying, so in order to cover the costs, the quantity has to go up. So quantity versus quality. Yeah. Yeah, no, exactly. Sunny, you had your hand up.
I think that the main point here that everybody's, I don't know if it's being skipped around or it just hasn't been considered. Working for years and years in shelters, rescues, and sanctuaries, we started a campaign 10, 12 years ago about raising the prestige, the value of cats, because statistically, cats are owned by more people than any other pet in the country, but they see vets less and less and less than dogs do, even some parrots. And so we all in the humane education world started to put a very big push on raising the status of cats as pets, and that they deserve medical care, they deserve better treatment, they deserve this, that, and the other thing. So I think what we're getting down to the bottom of this is that when people are looking at a high price for a medical service for a pet, everybody's going to be different. How much do they actually value their pet? It's not like a kid where your kid breaks his leg. You go to the hospital, you don't bother to ask how much it's going to cost to fix the kid's leg. You fix the kid's leg. My niece had a chicken that was attacked when I was visiting, and it was mangled up pretty bad by some sort of predator. And she goes, what do I do? What do I do? I said, you take it to the vet. So we took the chicken to the vet in Texas, of all places. If any of you are from Texas, no offense, but we took the chicken to the vet in Texas, and the vet doctored up the chicken, taught my niece how to give it antibiotics. We walked out, there was a cowboy standing there going, is that a chicken at the vet? And so it's all about how do people value their pets? And one of the things that everyone in the medical profession, I think, could team up on, this collegiality you're talking about, is educating the public about valuing their pets, and that all pets are sentient, that all pets have feelings and emotions, and that when they're hurt, when you take on a pet to begin with, it becomes your responsibility to care for that pet, which is what I told my niece about the chicken. You took this on. So you took on this responsibility like when you gave birth to your child. And so I think an overall method or an overall goal of setting up some educational programs, whether that's through your own individual office blogs or it's teaming up with each other in some sort of way to get the word out and start educating the public what you're going through, why the prices are going up, and the standard of cares that you're searching for, because the public does not know this. And then you will always have those people who do not value their pets as highly as other people do. Now, my little dog just went through a splenectomy. My vet was very hesitant to recommend anything. Of course, I know he was scared of what I would think about the cost, but I literally made him bring in an ultrasound technician. And we found this spleen with a tumor on it. So then he called in a specialty surgeon, which I didn't even know you could do. I thought I'd have to take him to another, large hospital. And he brought in a surgeon, and this guy did a fabulous job. And I was so grateful. And my little dog was home with me that very night. So all these options need to be out there, and the public needs to be educated. And I think that's one of the problems that the veterinary world is experiencing, is such a boom in technology, such a boom in chemical knowledge, such a boom in scientific research. But the public's left behind. They're not being educated in how valuable you people really are.
So,
because there isn't enough money in the world to pay for what you do.
yeah, thank you. So I'd actually like to respond to that myself, if that's okay. So in my experience as hospital director in a nonprofit world, we had individuals and families that valued their pets unbelievably so, and didn't have the funding to do to provide the care. And so in essence, what you're saying, Sunny, is it's true. There are individuals that have plenty of finances and they don't care. And then there are others that don't have the finances, and yet they care tremendously. And this is the last trend. And it's as a veterinary staff. And this is part of what creates such a difficult stress and emotional distress to much of the veterinary staff. And this goes from the reception, when they're having to hand the bill and say, here, sign these papers, to the technician that has to look the client in the eye and say, well, the doctor says we can't do this, to the doctor that has to talk to the client and say, I understand you have a parvo puppy. This is going to cost you $2,000 to $4,000 to $4,000 to come in to treat. And the client is like, well, I don't have that. So in the nonprofit world, and this brings the topic out to other countries, actually, where there are in some countries where their government helps to subsidize for some of the stray pet care and some of the medical support. And they help cover the costs of some of these public veterinary hospitals. So what you're bringing up here, Sunny, is a big part of those people that do care, and then those that and have the money, or they don't, and then those individuals that don't care, and helping to educate them about what the importance is and the feelings and so forth. So directing this into a component of those individuals where they do care. And we're now asking the cost of living and cost of housing and cost of veterinary care all going up and up and up. The fear now is, are we going to create a situation where having a pet and providing veterinary care to that pet becomes an elitist situation? And that is very frightening for many of us. I want to just share one more component that I feel is this is what brought me actually into where we are right now. When I started getting into veterinary medicine, it was a few years ago, right? But when I started in veterinary medicine, that was right the time when veterinarians were, like Dr. Pasic was saying, we were not charging for anything, $200 surgeries for critical aspects. And we were giving away nail trims for free, anal gland expressions for free. We were doing exams and rechecks at no cost whatsoever. And vaccines were 1/10 of the price of what they are now. So at that time, this was in about the 80s, 90s, some of these practice managers were coming into play and advising the hospitals at that time, pretty much, I'd say exclusively privately owned, but they were advising to say, look, guys, you need to raise your prices. Okay, you need to raise your prices. This is ridiculous. No wonder you're all starving veterinarians. So the veterinarians and the staff, being the people that they are always giving and just don't want to say no and want the best for the animal, are now feeling guilt about asking someone to pay for something because, we're in it because we love the animals. So what then transpired is another modality came into helping the veterinary community understand that we are providing a value to the owners. We're providing a value, an incredible amount of significant care to that patient, whether it be for more diagnostics and that complete comprehensive. So now, because we had raised the prices and we were guilty about this, we've now put so much emphasis on raising the value of what we create that we've fallen behind a little bit on our pricing again. And in providing the huge amount of value, we do everything we can to please the clients, to make people happy, to care for animals, regardless of the impact towards us. And hence we have the clients who are used to being pampered and spoiled and to get everything that they want, now having clients or having a staff that is scrambling to keep up and to fit this emergency one in, and a person that just suddenly is leaving town and they have to have the medications today. The staff is scrambling to get this all done and now stressed and frustrated. So that's where the comprehension component is, that now that we've raised the value, our prices have not flown up to compete with that again and bringing these solutions. So I know we're a little bit after the hour, and I want to make sure that we're providing value for those that are on the panel as well as those that are watching this. Thank you for letting me do that quick summary of things. What I'd like to invite, if there is anyone that is on the Facebook live right now, if you would like to ask any questions, you're more than welcome to do so. Just write it down in the comments. We would love to get some more insights. If you have some ideas, let us know. But other than that, where we're going with this is now, again, like we said, and just like Sunny, you're saying, finding the solutions. And Dr. I apologize, Dr. Coshell, we didn't get much chance to hear from you much, but bringing that collegiality in, and Dr. Coshell, I think you summarized it so well, that I'd like to focus on what you were saying at the end of those main 3 points, and how do we move forward from here? So what I'd like to close with at this point, unless we have some additional questions in the, unless we have additional questions in the chat room, I'd like to close and have each of you respond with one thought as to, if you had to give up one thing in order to make this dichotomy better, the value that we still are wanting to provide, but to increase the finances or cut costs, or to give people more, how we do business, how we're running our patient or client. If you had to give up one thing, what do you feel that would be, and what would you replace to improve where we are now? And I know that's a 2-part question, and it is a tough one. So as you're thinking about that, I'm going to go ahead and allow those of you that'd like to raise your hand if you want to do that, and allow that first. So if the rest of you want to think about it before we go. Otherwise, Dr. Coshell, would you be okay in starting out this response? Because I know you already brought out several solutions.
Yeah. In direct response to your question, as far as what would I give up, I've thought about that. As far as right now in my life, I'm at a pretty nice place. Doing relief is financially rewarding, psychologically rewarding. I get thank yous with my checks. I learn something new everywhere I go, and I can choose where I go at this point. I have a nice roster of hospitals that I love to go to, and they like to have me. So that's really nice. And I think I might be at the point where I'm ready to give up that comfort and move into providing that solution. I hate to be the person that sits on the sideline and says, oh yeah, everyone else should do this, and not be the person who's going, okay, then, I'm going to be part of the solution. And so in thinking about these ideas, I hope to move forward in reality with one of them, as far as finding some people that are interested in the same things I am and moving into my ideas to see if we can be part of the solution.
I love hearing that. And I do hope that your trip to Colorado works out so we can perhaps collaborate on some of that. Thank you very, very much, Dr. Coshell. And that sounds like a good lead into implementation as well. So I'm just going to kind of go along the order here. Dr. Pasic.
Okay, so I like the idea with, Sunny trying to do outreach and trying to get a cohesive message out to the public about what our lives are like. And I would personally like to ban every veterinary doctor show on the Animal Planet right now. There's just that's killing our image. So if we have to find a way to get all of us on the same thing, let's keep it professional, let's keep it honest, and let's let the media, if that's who it's going to have to be that reaches all of us, whether it be through social platforms or whatever else, but let's make it real instead of just this sensationalized, not representative. I don't even watch it. It turns my stomach. But I think if there's a way to do outreach, maybe that's where we start, because that's where everyone plugs in.
I love it. And that's so heartfelt. Like I just see it in your eyes, Dr. Pasic. It's so heartfelt. Thank you for sharing that. Liz, what are your thoughts?
Gosh, I'm not sure how to answer this question. When I first heard the question, my first thought was, personally, what would I give up? I work in a corporate veterinary hospital as a part-time staff member, and I would give up my pet benefits in order to have benefits like PTO and bereavement. I didn't really think about these sort of benefits like bereavement until I needed it this year, and I didn't have it, and I wasn't supported by my hospital. So I would prefer benefits that take care of me and my mental well-being.
That's powerful. And I'm sorry that you had to go through that. So we are here for you, girl. And Kathy, I know you're already doing quite a bit in this realm of things. So Kathy, I'm going to let you still put some input in what you're heading into.
Yeah, I feel like personally for me, it was such a big deal for me to step away. And that's what I had to give up, was actually being in the field. Personally, from burnout and the mental and emotional aspect of it, it had laid a lot on me. And because our field is so struggling with suicide, and I am just more of the mental health awareness type of person. And me meeting you, Ingrid, has just created such a great opportunity for this platform to educate, to help people get tools. And so I'm willing to, in a way, sacrifice myself and tell my story and be on a platform and speak and make people feel comfortable with the struggle. And, a lot of people turn to addictions to cope. I think our field is also extremely high with the controlled drugs being used and stolen. Personally at clinics, I've seen a couple of hospitals that I've worked at that has gone through that. And, I know it is a crime, but to help them seek help, rehab, this is a disease, and the stress and emotional factors that happen in our job, it's also an emotional, mental, physical, spiritually draining thing. And I am just so ready for the shift and the change, and how I can be there and help support and make everyone know that they are not alone in this, whatever aspect or dynamic they're in. I just never want anyone to feel alone. So in some way, at some point, I will sacrifice myself and tell my story, and just not let anyone ever feel alone in any place that they're at in this.
I know you've already done that, Kathy. So thank you for sharing that. Daisy, we're going to circle around to you.
Right. I think what I would want to give up is that sense of isolation, like we were discussing earlier, whether it's corporate hospitals or privately owned hospitals. I do feel that there is a lot of isolation with us wanting to be competitive and not really even knowing what's down the street as far as resources. We have CT scans, doctors or vet clinics that have CT scans that are not being utilized because we don't know about them. So I would want to give up that kind of old mentality of thinking where it's just our clinic, and I would want it to be replaced with more networking between just the hospitals in the community, whether they are corporately owned or not. I feel that acquired hospitals should still have that want to help each other, because ultimately we're here for the pets. And if we are not helping each other and networking with each other, then there is one pet who's left out because either this hospital is completely up to the max and we are not utilizing our resources appropriately. So I would want to really see a shift in that type of mentality and just really embracing ourselves in this industry, because we are all in the same boat, whether we have millions of dollars backing us up or not. We are all experiencing the same issues that are plaguing our veterinary industry. And so I would really want to just see more of a collaborative approach with our industry.
Oh my gosh, that is so well said. Oh, Daisy, we are really going to be talking to. So I was like, I know where this is going. All right. So the Taylor family, little Snickers, I'm going to move it to you. What do you think about this?
Yes. First, I'd like to say thank you, Ingrid, for inviting me to this panel again. It was so eye-opening and educational and informative.
Much appreciated.
Yeah, and my husband. And my thoughts around that question is, what I'm willing to give up is I'm willing to give up the extra $20, $50, couple of $100 for the well-being of the staff, right? Because if the staff is taken care of, I know that my pet will be taken care of. And you don't want that undue stress onto someone that has your baby in their care. They shouldn't be stressed out worrying about, to Liz's point, not having bereavement or time off to kind of regain just the mental stability. And from just the vet themselves, the veterinarians themselves, that establishment, for the right equipment to take care of the pet. So, the money, and it's just like anything else. Things go up. You find a way to pay the cost, right? Gas is up. You're gonna pay, right? You're gonna walk to work or whatever. So I think there's a way. So, if anything, what I'll take away is just like, guys, don't feel guilty, about charging for the service that you're providing. Because at the end of the day, true pet owners really care about their animals and they just want the best. So I'm willing to give up that extra, whatever the cost is, $10, $100, for the well-being, just overall. And, guys, you just open my eyes to a lot that's on the flip side of it. So thank you again.
Zakia, I had tears in my eyes as you were saying that. And I was watching the faces of the panelists and I could see the smiles and I could almost see there's Dr. Pasic raising her hand for that. I could just see the glow of appreciation for you saying that. And that is enormous. Thank you so much. Thank you so much.
Ingrid, can I interrupt real quick?
Please.
Before we finish this tonight, can I see Snickers?
Oh yeah, let me grab him real quick. He tried to run after my husband.
And then while Zakia's running to get that, you know what, Sunny, I'd like for you to jump in. Yes. Sunny, I'd like you to jump in and then we'll finish up with Lori, just because of the commentary that Zakia just made that was exactly echoing what you had said. So did we lose Sunny?
No, I'm here.
There you are.
Okay. I totally agree. The thing I thought about this, what I would give up is money. I have always said, and perhaps we can get this in an educational form to clients. You make up your priorities before you check your pet in. And my priorities have always been, if I can fix it, if the vet can fix it, I will pay whatever I need to pay. If you can't fix it, let's make them as comfortable as possible, to Liz's point. Keep them as comfortable as possible till the inevitable end. So money is the first thing I would give up, but I want every single one of you in the vet profession to understand that you need to take care of yourself, because if you try to squeeze in 40 clients a day and you burn yourself out, nobody's going to get helped. If you need to raise your prices and lose 20 clients, you're going to be doing quality care for 20 more. You have to think of yourself as the goose who lays the golden eggs. You are in charge of the eggs, but you are the goose. And without the goose, there would be no golden eggs. So you must take care of yourselves.
Thank you, Sunny. It's so encouraging to hear you saying that as I work with these struggling hospitals and struggling team members. We're building more and more opportunities to support them for that specific reason. And thank you very, very much. That's beautifully said. So I'll have to remember the golden goose. All right, we got to circle back. Show us Snickers. Show us Snickers. There's our little Snickies.
Hi. He's like, take me back, my daddy.
I love those little noses. Hey, Snickers, thanks for taking care of such good mom, dad there. All right, we're going to go ahead and move to Lori. I wanted to close up with you, and I think I got everybody on this question. Is that right? If I missed someone, I apologize. But Lori, let's go ahead and have you answer that question.
Yeah, I want to just mirror what Liz says. This was a really hard question. I had all my answers typed up, by the way, for this. And that was the only one I had blank. And I was like, but I think about it a little more. And I feel like the number one thing that's so important to people is time. And I would be willing to give up my time, my extra time, to advocate for these animals, to educate people, because I really feel that education, teaching clients why, teaching teammates, why it's important to just bond as a team, veterinarians, everything. I would be willing to give up my time to be able to make that difference, be that change in this industry, because it is, we're depleting ourselves. We're getting smaller and smaller. And I think we all know that animals are such a huge, they're emotional support animals for all of us. They completely are unconditional. And I feel like we benefit from them so much. They do so much for us. And so I feel like we need to circle back around, give our time, and really advocate for them.
Wow. I was excited about this panel. And what I can say is I think it's only fair for me to answer this question as well. What I would give up, and I actually had not thought about what I would, and so this is coming straight from the heart, is I would give up, like what you're saying, Laura, I would give up my time, and I would give up what I can to move this and to make this movement real. Because it's not just in the veterinary world. We're seeing it in the airline industry. We're seeing it even in the restaurant. It's just like people are leaving in droves because they're not taking care of themselves. And that's the passion, what we want to get back. So I so appreciate each of you coming on this panel, spending your time to be here to help educate each other, to help educate the world about what our community is facing and how we can now move forward into establishing definite steps, concrete steps, and making sure that the reason we're here is to take care of those animals, and also do that in a way that the passion for those caregivers and for the families remains solid and sustainable. So I do want to close with a huge thank you for all of you. VetMatch Chat, we are here. We are here to support you. I'd love for you to follow us on our Facebook group, on our Instagram. We even have a LinkedIn page. And I will also, when this is done and recorded, I will have a link down below in the comments that you can join the VetMatch Chat community, and we'll keep you posted whenever we have more of these panels. If you'd like to be on a panel, please let me know and we can get you in. And if you'd like to be on another forward moving, because we definitely ultimately I've got succinct steps that I heard tonight from each one of you of what the next steps are. So this is just the beginning of a brilliant journey that all of you are a part of. And I thank you so very, very much. I am Dr. Ingrid Pika, and on behalf of the entire veterinary community, I'm just going to represent them. I thank you all for those of you that take care of your pets. And I give huge, cherished, passionate thank you for those of you that take care of them from a medical side as well. And for those of you that are in the levels where you are in delving into and struggling in how to solve these problems, and you're actively involved in that on a management or leadership or an ownership role, we're here as a support. This network, it's just beginning and it's growing huge. So I thank you all so much and wish you all the best. Please share and keep connecting. Good night.